Guys, it's Miss Woodruff and Miss B, and we're here today to do some more clinical skills. So we recently taught you about how to do IV fluid. So the next step is to teach about a piggyback. And first I want to clarify, if you go up to your nurse and say, hey, this semester I need to do an IV piggyback, they may say, oh, I don't have any of those today, as they hang an antibiotic. And so a lot of times what you may be wanting to ask instead is, hey, I need to do an intermittent infusion. So in other words, when we talked about IV fluids, they're going continuously, like this much every hour, or what a piggyback or an intermittent infusion is that something's going for a period of time. So some common things that can be given intermittent would be antibiotics, some pain medications, fever reducers can be given, IV. Anything else you can think
Electrolytes.
of? Electrolytes, that's a good one. So electrolytes can be given IV piggyback or intermittent infusion. So there's a variety of things that can be given in that way. So you always want to consider, that difference there. And the difference there is that it's only going to be going usually for a few hours. It's not going to be going continuously long over time. It's called piggyback. If you choose to piggyback, which is what we're going to show you today, is because we're actually piggybacking on this fluid. So in other words, we are getting on top of, or behind the fluid that's already going. So that's why it's called a piggyback. So we're going to kind of show you this process. I was just saying if we had the little hanger thing. Oh, yeah. Okay, good. All right, perfect. So the key principle, a lot of the IV stuff is going to be the same. When we talk about IV stuff, you always need to check for compatibilities. You're looking for the right medication, right patient, checking your orders, seeing what's the purpose of this, how is this going to help my patient. Keeping in mind some stuff that can be given piggyback can have side effects. Like for example, you may think like, antibiotics only when given PO upset the stomach, but sometimes even IV piggyback, there can be nausea with those. You want to think about if I'm giving an electrolyte like potassium, that can be really hard on the blood vessels. And so there can be burning with that. So you always have to kind of keep these things in mind as you're doing these meds. You want to check those precautions. So in order to give something officially piggyback, which again, I'm an ICU nurse, so I put everything in its own pump. I don't know if I've ever piggybacked anything unless I've had to, but some nurses have to, and that they need to have that just depending on that. So we're going to show you about what that looks like to piggyback a fluid. So the first step is we have to have, of course, I told you about, we did all of our double checks. We have to have a patient who, in order to piggyback, we have to have a primary fluid. So let's say that we have our IV fluids going here for this patient. And then I need to hang an antibiotic. So here's my intermittent infusion, and we're going to pretend like it's not empty because we're having a little bit of tubing issue. TCC tubing, it does the best that it can with the life that it has left. So first I'm, double checking. And one thing I want to note is that, like, let's say you go in and you have a patient with IV fluids going and you did hang an intermittent. If you have not yet, assess that IV. Just because the IV fluids are pushing and it seems to be working does not mean that that IV is still good. You should always, at least once a shift, disconnect right at the patient, flush that IV to make sure that it's working effectively. So then what I'm going to do, I'm going to look and, go all the way. All right, I have my primary fluids going and they're going into the patient. So then the next step is I need to prepare my IV piggyback medication. And I'm going to do that very similar to what I did before. I need my supplies. I need my medication. I need my tubing, and I need, I don't even know what we'd call this. The hangy thing.
The hangy thing. The hangy thingy-majigga.
That is actually the official term per the dictionary. So the hangy thingamajigga. So that is going to help to, we'll talk about how that helps here in a minute. But Ms. B was going to talk to you about tubing because she is a tubing enthusiast.
So in the previous video, I told you that the primary tubing was long, it had white sides, it had several clamps, different clamps. Well, the secondary tubing is this short. Look, I could fit it from one hand to the other. It only has one clamp, a rolling clamp, and it does not have white sides. So that's the main difference between them two. And that's how you're going to recognize them in the bagging that comes, because not only is it going to come with a hangy thingy-majigga that we named this thing, but it's also going to be, you're going to see that it's shorter and it just has one rolling clamp. Okay.
Mm-hmm. So yeah, so like we did previously, we're going to untangle everything. We have all of our supplies, and first thing, obviously there would normally be a cap on top of this end and this end, so everything has remained sterile. And the first step we would do is to clamp our tubing, make sure everything is clamped well so that nothing will be lost. So everything, so remember, we always go from fat to skinny, go to the small side in order to clamp. Now this tubing is not staying clamped well, which is why we emptied it so that Miss B does not get all wet. So just we'll play pretend and pretend that this is a bag full of fluid. So the next step, and again, just like with primary fluid, it really doesn't matter whether you spike down. Some nurses prefer to spike like this because you can actually push all the air out of it. And some nurses really like all the air out of it. That's complete, nurse preference. There is not right or wrong there. So you can go ahead and spike your bag when you're ready. So I'm going to take off the top, and then I'm going to take off both my tops and spike my bag aseptically as it spills all over Miss B. So yeah, so then we are going to flip it upside down, and at this point we can hang it up here. I always like to hang it that way. It gives me better visualization. And again, we'll squeeze a little bit. There's a little bit of fluid in here. So normally I would fill it up about halfway. So I have my piggyback here, and then we're going to do the same thing we did with the other. Now we're going to just play make-believe this time because like I said, we're having a problem with this tubing, but I would prime the tubing. But the thing to keep in mind with this tubing compared to the others is there's not as long and there's not as many stoppers. And so when you prime this tubing, it goes quick, especially with normal tubing, TCC tubing. So especially with this is like something, sometimes these are really tiny bags of medication. So you really don't want to waste any of that medicine. So you need to be watching it really closely and just really lightly letting up on that clamp and priming it slowly. So once you have it primed, then you're going to go over to your port. And a lot of students ask us, where do I connect it to? You want to go to the port that is above the pump. So you see the blue here that's above the pump. Let me make sure that you can see that. Blue above the pump. There is a port here that's a, a Y port is sometimes what it's called, that you are going to attach this to. Well, this is dirty. And even if it has one of those caps on it, I recommend, get in good habits, cleaning stuff, take the cap off, clean it for the allotted amount of time. And then you are going to connect your medication.
Push in and twist.
Mm-hmm. So yes, and then the next step is that, when you're ready to, you can unclamp that. If you don't, it's not a big deal. The pump will tell you, hey, I'm clamped, but you can unclamp it like that. The next step, because like I mentioned with the piggyback, the whole thing is that I have something continuously going, and I'm trying to tell the pump that, hey, I want this small bag to go instead of this large bag. So in today's world, oh, it looks like it was going, and I was like, oh, so do you want to clamp this? Oh yeah, there you go. So yeah, I was like, are we filling back up? Yeah. Anyway, sorry, technical difficulties. I know that you love this on our channel. What I was saying is today's world, the pumps are really smart and you don't really have to use the thingamajigabobs. I'm going to show you how to use those so that you know the proper procedure for your Wait, God. Would you flip?
It's filling into the secondary.
Oh, it's filling into that one. Okay. Yeah.
Maybe lower.
Yeah, maybe lower. Okay, yeah. So anyway, sorry about that. It has its own mind. So yeah, so needless to say, whatever. The whole purpose of this is that, previously before the pumps got so smart is that you would have to lower, and you want to lower whatever you're not using. Because like what Miss B was just doing, we're lowering this in order to allow gravity to have this one go first. So pretty much if you want to show us how to use the thingamajigabobber.
Okay, there's a couple of, this is nurse preference, guys. You'll see it different ways in the hospital. I have seen it hook and just hanging from one of the hooks on the top of the pole. I have seen it where nurses thread this through here and hang it this way. I have seen it like that, like twisting it here, like, so just different ways, but really the main thing that you want is that you want the primary lower than your secondary. And with the hanging
jigger bobber.
Yeah, that serves that purpose, basically helps you lower the primary.
Yeah. And so once you have that lower, then that's helping the pump to know that this is what's supposed to be going. But it can't know that all by itself. You also have to program it in the pump. And we'll show you how to do that in a separate video. But effectively, the whole thing is that, like I said, just to kind of summarize, is you're making sure that whatever these two are is compatible. You're making sure to aseptically, connect everything, to make sure to prime your tubing and have everything connected. Because sometimes that can be the thing you forget. Always prime your tubing or there's just a whole lot of air. What do you call it? And once you connect it, the great thing about piggyback too is in the pump is what it does is this finishes, and as soon as this finishes, this restarts, and this doesn't have to be back up. It will still go with the pump.
One thing I want to let you guys know is because it has happened to me, has happened to nurses I work with in the med surg floor. I know Miss W doesn't really work with piggybacks, but I do. And is that once you connect it, if you accidentally forget to unclamp your rolling clamp on your secondary and you program your pump for secondary, what the pump is going to do is going to take the fluid from the primary. So let's fast forward 30 minutes from here, an hour or so, and you come back to the room because the medication has been done and really the medication is still in here and it has just pulled it from the primary. So now your medication is late. So don't forget, always remember to unclamp it from here because if not, it's going to take it from the primary. And technically, it's considered a medication error. It has happened before with people that I work with. So just to let you know.
Okay, great. Did you have anything else to add?
No, I think we did it.
Yeah, so the only thing I'll add is just the follow-up. So whatever it is, if it's an antibiotic, I'm looking on that patient. Where's their infection? How can I make sure that this is working, whether it's vital signs or otherwise? If it's, an electrolyte, I want to follow up with that lab and stuff. And also that's something I guess we didn't bring up before is, of course, if it's an electrolyte, we want to check that level before we give it. We always want to make sure that it's appropriate and stuff like that. But yeah, so just do your appropriate follow-ups. Maybe watching that IV side, especially if you're giving something that's a vesicant. Always be looking for any changes there. And yeah, I think that's it. Okay, we'll see you next time. Bye.